Hi, everyone. This is Lynn Boyer, the Executive Director of Community Impact here at the YMCA of Greater Nashua. As part of my responsibilities, I share a weekly Wednesday Wonder, and I thought it might be a great idea to include our community partners in that as well. So once a month moving forward, we are going to highlight one of our community partners on a podcast called Community Conversations. And to join me on our inaugural podcast today, I have a few friends from the Greater Nashua Division of Public Health and Community Services, and they're going to talk about their organization, the work that they do, and how they partner with the Y. So welcome. We'll do some introductions. So Iraida, go ahead.
Good morning, buenos días. Mi nombre es Iraida Munoz. My name is Iraida Munoz, and I work for the City of Nashua Division of Public Health and Community Services as a Public Health Equity Officer.
Good morning, and thank you for having us, Lynn. My name is Leah Elliot, and I'm the Behavioral Health Specialist for the City of Nashua Division of Public Health and Community Services. I'm a licensed social worker and a certified prevention specialist.
Awesome. Thank you both for joining me today. So if you can just share in a few words what it is that your organization does, where it's located, and who you serve.
Sure. So we are the public health of the City of Nashua and region. We serve the towns of Amherst, Hollis, Hudson, Litchfield, Linderboro, Mason, Merrimack, Milford, Mount Vernon, Pelham, and Wilton. And we are located at 18 Mulberry Street in Nashua, New Hampshire. What we do basically is attending the public in general. Everybody is welcome. We try to serve as many folks as we can, especially those in higher needs in an equal way.
Great. And is this easy access for everyone in the community? Are they able to get there via public transportation?
Correct. So we're located in Main Street area, very close to the bus, the transit, and it's very easy to follow. There's parking around us, and people can also walk to our building. We are open door policy.
Okay, excellent. Thank you. And what are some of the partnerships and collaborations that your organization has had with the YMCA in the past?
We do a lot, where we look at my role as the behavioral health specialist. We want to make sure that when people hear public health, that they know that that encompasses behavioral health as well as physical health. And we do a great job of introducing our young kids to the concepts of dental health and physical health. And we say, hey, make sure you're brushing your teeth and you're flossing and you're eating healthy. We want to make sure, through our role in community services, that we are introducing youth to the concept of mental health, just as young as they are learning concepts such as dental health and physical health. And so a lot of what I've done in my role is come in during school vacation weeks and summer breaks when you have your amazing childcare program and read books with little kids. So I've come in 2 years in a row. The first year I came in, I read a book called Gizmo's Possum Guide to Mental Health, which is a book about a service dog, an emotional support service dog. And at the end of the book, which introduces youth to the concept of thoughts and feelings and behaviors, is they can develop a mental health plan of their own. And because, as we know, sometimes when we get upset, it's hard to access that thinking part of the brain to think about what we might need to do. But where the youth now have a plan in their hands that they've written and they know that it's things that they like to do, they can refer back to that if they're having a difficult time. And then the second year I came in, I read a book called Little Spot of Feelings. And they talk about all the different feelings that we have, from anger to sadness and worry. And not only do the books provide the kids with a useful tool that they can use to calm themselves down using their hand, it also, again, continues to help them to identify different feelings. Sometimes mad is that default feeling, sad is that default feeling. And if we can help them to understand what might be going on, they can now identify a more relevant feeling so that they can address that feeling. And so it's been really great working with the childcare program and being able to come in as a guest speaker. And funny enough, on Halloween, I actually had a kiddo come to my house for trick-or-treating, and he recognized me. He was like, "You're the lady that read the books at the Y." I'm like, "That was me." So it's nice.
That's so great. And I know that the kids really love that. We had such positive feedback from the kids and the family. So thank you for doing that. It was very, very helpful and impactful for them for sure. What's something exciting that your organization has coming up or something that your organization accomplished recently that you can share with us?
So here at the division, we do a lot of exciting things. Every day we have something exciting going on. But one of the things that we are really working very hard lately has been the community health assessment and the interactive dashboard that we're about to launch this upcoming winter time. So the goal, the overachieving goal for that, what we call it the CHA, is to engage community members and identify those issues that are out there and set foundations for future programming in the region. So what what we did a lot, and the Y was a great partner, was do some listening sessions. We actually did it in English and Spanish. And we hosted, I think, 2 or 3 of them at the Nashua YMCA location. And we sat down and we listened to what they needed to say about their needs in different aspects of health. Not only the physical health, as Leah said, but also the mental health, and how did they feel about what wellness means and what do they feel like the community is in need. So we took big notes about it, and we are just collecting all that data. We are collecting it and analyzing it, and then we're gonna disseminate the information on the community assessment strengths, resources, and needs very soon. That's a big project that we're running right now. That's just one of them. But Leah has other examples that she can definitely talk about. Leah.
So yeah, so in addition to assisting with the community health assessments, which as a therapist, I look at such as a treatment plan for the city, that then we can go and address some of those concerns, like introducing kids to the concept of mental health. But one of the other things that we saw in our need in our community was the police, have to spend a lot of time responding to 911 calls for people that might be in a behavioral health crisis. And so we have been working collaboratively with the police to assist them in responding to mental health calls so that their officers can be free to handle other things that they need to be handling in the city. And so myself and my coworker, we developed a program called the Greater Nashua Public Health Nashua Police Department Behavioral Health Co-Response Program. And so both of us spend 20 hours a week working with the police department to respond to any mental health calls. So we have helped with people that were having suicidal ideation, as well as supporting family members who might have a loved one that they have concerns about that may need assistance with assessing and being able to access mental health services. So that's where Lisa and I can come in and assist the family. And so it's been a really great program. The police department has been extremely welcoming and excited to have us there. We were lucky enough to be able to talk with a couple of other police departments, such as Fitchburg, Massachusetts, Arlington, Massachusetts, and Dover, New Hampshire, that have similar programs. And we hope to be able to provide technical assistance maybe to some other police departments that are looking into having this program with their police department. And just being able to go in with the police department, we talk a lot about wanting to be a trauma-informed community. And we know that when people see the police, sometimes it can make them to feel anxious. And so if one of us could potentially ease that anxiety so they could stay in the moment to address whatever need led the police there in the first place.
Yeah, that sounds really great. And what an accomplishment for you guys to be working on, and what a support for the community as well. That's wonderful. What are you most proud of that your organization has accomplished? What are you most proud of to say about your organization?
I have to say the staff, the incredible staff that we have in this organization. We focus on serving everyone in our region in a unique way. So we have professionals trained to deal with urgent and emergency situations in different languages. So everything we work and educate in our community has been in the languages of English, Spanish, and Portuguese. And thanks to our multicultural workforce, we can educate and communicate in up to 8 languages. So that's really amazing. It gives us the ability to do our work effectively and at the same time help our community departments and partners to do so here at the city of Nashua and our region. So that's one of the biggest things that I will always celebrate, because we have a great staff members.
And everybody's very creative and able to identify and address concerning things in the community and coming up with really creative ways to address them. We have a great team of people that work here that have so many different strengths, and you put them all together and under great leadership, and we've been doing some really great things.
That's awesome. Great. If you want our audience to know one thing, one takeaway about your organization, what would it be?
I would say really that we are here, and we are here to help in any capacity that we can. And if there's something that we can help with, but maybe we don't know how to help with, we are very interested in learning and being able to provide that service. So I think of myself, and we do a lot of training to the community. And so if there's an agency or a person out there that's wants some more information, we can develop a training. We can come do the training. We have a lot of presence on social media that talks about a lot of the things that we're doing, and people are always surprised to hear all the different things that we do. So I think for people to know what we're capable of and what we are doing, and continue to work with us and have us come out and collaborate with you, just like we have done with the YMCA. So it's been great.
Great. Iraida, anything you want to add? One thing you wish people knew about the public health department?
I wish they knew that we are four departments. So we have the clinic downstairs. So it's open and available for everybody, uninsured or underinsured, or whoever needs help with vaccinations and other type of services. So that's one department. We have the environmental health department, which is actually the ones that takes care of our community, our pools, our public schools, our public restaurants, and everything that is public, and it's safety first, obviously. We have our third department, which is the community services department, which is the one that Leah and I work on. And our mission is to go out and work with the public right away over there. And then we have the welfare department, which is the department for people that is in a particular need when they need a bill to pay and they couldn't make it, or they are about to be evicted, or they have a medication that unfortunately they are not in the position to take care of. They can come to this office and ask for those services right away. So we have a lot of services that people might not even know. So I encourage people to call if they are in an urgent need and see how we can help.
Great. Yeah, that's really important to know. I
Mhm.
didn't know that either. So I learned something too. Awesome. Well, thank you so much for everything that you do for our community and your partnership with the Y. I can speak for the Y to say that we truly value our connection and our partnership. And I look forward to collaborating even more in the future. So thank you both again for joining me on my first podcast. Anything else you want to share or say?
I wish you the best. This is a great idea. And I believe we are going to do great things in the future. And thanks for having us.
Yeah, absolutely.
Yes, thank you. I love the YMCA. I was a YMCA kid. I grew up in Everett, Massachusetts, and we went to the Malden YMCA, and it was a great place for me to come when my kids were little. That I would bring them there for the different activities, and I'm really happy to be able to continue to collaborate with the YMCA.
That's great. We love hearing that people are YMCA kids or had their first job with us. It's a great story. Great. Well, thank you guys again. And thank you for everything that you do in your community. And thanks for joining me in this community conversation.
Thank you.